Hi, I just wanted to give you a quick review of the Kalecope Q60 shockwave therapy device that I bought on Amazon. I just say that I'm a urologist and I've had quite a considerable experience delivering shockwave therapy for erectile dysfunction. This machine I found to be very substantial, well-built, good functioning machine that can adequately deliver a good treatment of shockwave therapy, not just for erectile dysfunction, but importantly for many other parts of the body, using a fascinating science of shockwave therapy, which I encourage you to explore and learn more about. Basically, what shockwave therapy does is it marshals the body's own healing mechanisms to improve tissue function, heal tissue, revitalize tissue, using the body's mesenchymal stem cells and cell signaling factors. This machine works well. I wanted to just talk with you a couple of things about this machine. I wanted to first talk to you about the handle. It's an important part of this. It's the treatment handle, and it consists of a handle, an on-off button to start the treatment, and the tube through which the energy is delivered to the treatment head. This machine comes with several treatment heads for various parts of the body and various different tissue functions. Most of those are outlined pretty well on the machine as to which one you should use first. There are some important aspects to this as well. This all kind of comes apart. On the end, the treatment heads actually unscrew from the shaft itself, and the machine comes with several different size treatment heads for treating various parts of the body. Some of them are quite large in their face diameter. Others are smaller for more focused and deeper penetrating shock waves. The other part of this also comes apart, and this unscrews. You need to be careful with this because inside of here is a bullet, a projectile that vibrates back and forth through this tube to deliver the electrical energy to the end of this treatment head. And it does so through pneumatic pressure, through air pressure. An important part of taking this apart is to be careful with the handle portion, because these components inside the treatment handle can come out, and you'll save yourself a lot of trouble in trying to put them back in if you just keep it upright, lay it down gently when you're going to work on the tube. The tube comes out entirely for cleaning with the provided brush. And then when it's replaced, it's important that these holes that are present down at the end here are fitted into the treatment handle and not at the other end. Move this about a little bit and it'll go all the way back down into the treatment tube. So if we take a quick look at this, we'll see that inside of this tube is a little bullet. The machine comes with some extra bullets. These will wear out over many hundreds of thousands of shocks. They should probably be lubricated with a fine sewing machine oil, just a drop to keep it sliding well in and out of the tube. You can pull the tube out completely, clean it with the brush, and put it back in with the holes present in the end at the end that screws into the treatment handle. So I'm going to put this back together. It's a nicely machined device. This screws back in. Be careful not to cross thread it. The other part of this is that's important is the plug, and this machine will not run with the plug. You shouldn't try to run it without the plug. It fits in one way. There's a little plastic nubbin that fits properly into this. It just slides in, get a nice tight fit on it, so it's snug into the receptacle there. And then we're ready to show you how this works. So the button for turning this on is way in the back of the machine next to the water drainage valve. We'll turn that on and our screen comes up. Immediately what you see are a bunch of different options for body parts to be treated. What they really are are a good starting point for various parts of the body. They can be adjusted further within each one of these treatment programs. Down at the bottom is a universal one you can set for however you like. But really, these represent good treatment starting points for you. So what we're going to do is we're going to just pick this one that says low frequency. And this gives us a display screen that shows how many counts we're delivering, the strength of the pressure within the treatment tube, and the frequency of beats per minute. The first thing you want to do is press the start button, and that'll fire up the compressor. You'll hear it here. And it develops enough pressure to move the bullet back and forth inside of this treatment handle. It's very expected and normal for this machine to turn off and on as it regenerates enough pressure to deliver the amount needed to do the treatment. The hertz pressure, the number of times per second that you're getting treatment. So you can change the bar settings, the count settings anywhere from 500 to I think 3000. The bar settings from 0.5 bar to 8 bar pressure, and the frequency from 1 per second to 22 times per second. So now we have the thing started up, and what we want to do is start the treatment handle, which can either be done with the button on the treatment device or with this button here. They both do the same thing. So now this is delivering a shock of 1 bar pressure at 1 time per second. And if we leave it going here, it'll do this 1,000 times and then it'll stop automatically. To turn it off, you can press this button on the handle, which also restarts it, or you can stop it here. An important detail in this I've learned is that one wants to shut this off properly. So if you're going to go back to the treatment algorithms or shut down the machine completely, you should stop the treatment handle, turn off the main engine, push the back button in the center, wait for the compressor to completely let the air out of the system, and then press the power off. That doesn't turn off the machine. You need to reach behind here and turn off the machine manually in the back with the on-off button. Also, what you need to do when you're finished with this, and you'll see there's a little cylinder in the back with a valve on the bottom, is drain out any water each time that collects within the device. There'll always be a little water there, and the longer you treat, the more water may be in that little canister back there. But all in all, I think I can safely recommend the Kalecope Q60 shockwave therapy machine. I think it's quality merchandise. I think it's suitable for home use, but even in the office setting, I've found support with the company to be phenomenal for any little issue that comes up. I give this 5 stars, highly recommend it.